Hi, everybody. This is Lee. And once again, I'm talking about Medicare for All. The fact that we have had experience with single payer healthcare here in the United States. Medicare is a type of single payer healthcare with the caveat that the person has to be 65 years or older for the most part. There was one place in the United States where there was an exception made that they took away the requirement of age. In fact, that they provided Medicare for all ages. This was in Libby, Montana. The reason why this happened is because of an unfortunate episode that there was a poisoning of the citizens, an environmental poisoning by a large corporation that caused asbestos poisoning of the residents in Lincoln County, which is Libby, Montana. There's a document from Social Security Administration. I'll try to have a link in the description. Medicare coverage for individuals exposed to asbestos in Lincoln County, Montana, where it explains the coverage. Medicare coverage is available for certain individuals who were exposed to asbestos in Lincoln County, Montana. And so it just went through the criteria of how to sign up and if you already have Medicare and and how you apply, things like that. And so I'll let people read through that so they can learn what it was and then give a background on why it came to be. There's another article, it's from asbestos.com, and it's from 2013. Special Medicare program benefits Montana asbestos victims. And so it discusses the Affordable Care Act and the controversy surrounding that. But what a lot of people did not notice or really pay attention to was that there was a special provision in the Affordable Care Act that was there to help the citizens of Libby, the asbestos victims, with their public health care emergency. And this was because of Senator Max Baucus of Montana. He was a Democrat. He worked with the citizens there to get that provision into the Affordable Care Act. And this article goes through a couple of cases where it describes the people of that community. It gives the background that there was a vermiculite mine and that there was a whistleblower who exposed the asbestos contamination. Naturally, the mining company fought against that, tried to conceal it, tried to cover it up, and went back and forth. And meanwhile, people were dying and developing cancer. And so there's been decades of legal actions, and so there were court situations and judgments and settlements and things like that. And then one of the settlements was, the fact that it was a public health emergency. And so there was a demand for medical coverage, Medicare for all. Max Baucus arranged that. And so that's how they took care of the people in Montana. It was a pilot program. The settlement was one of biggest success for the Libby residents and the Max Baucus who represented them. And so that's that article from asbestos.com. The Physicians for a National Healthcare Program also runs through a description of that situation out in Libby and how the people were taken care of. This is how Libby, Montana got Medicare for all. This is dated June 2011. And so again, it gives the background and it goes even further into the controversy behind the single payer healthcare provision. Max Baucus fought for the single-payer healthcare provision for Libby, Montana. But when it came to everyone else in the United States, when people tried to raise the issue of how about Medicare for all of us, how about single payer healthcare, universal healthcare for everyone, he actually called for the police to come into the Senate chamber to shut down that discussion. So a little bit strange that he would back Medicare for all in Montana and then call for police and security against people who wanted to also have that medical coverage. It's just part of the strange discussion that we have around medical care. The fact that Baucus did right by his home state and the people that needed help, people who were dying, people had been poisoned by the corporations, basically attacked and murdered by these corporations with environmental contamination. Baucus did what he was supposed to do as the representative of that particular area of Montana, and then shut down everyone else in the nation who may have also had environmental issues or health issues. And so I'm going to leave a link to these articles in the description and let people read through it. The fact that Medicare itself is a type of single payer health care for those who are 65 and older, and that this situation in Libby, Montana, Lincoln County, actually served as a pilot program. The fact that Medicare for all was provided for people of all ages, specifically because of the environmental contamination, the asbestos poisoning. And you can see for yourself how that worked, how people were desperately in need of health care. Not health care insurance, not health insurance, but health care. And they actually got it. There were many ways that they were benefited. There were many provisions, and I'll see if I can find specifically what was provided to them. Okay, so the people who were considered eligible, that they were actually residents in the time period that was specified. They lived in Lincoln County for a total of 6 months, ending at least 10 years before the diagnosis of asbestos-related disease. And they received the following benefits without a waiting period, without any quibbling or questioning or anything like that. It was just, boom, healthcare. So they got free hospital insurance, which is Medicare Part A. They had the ability to enroll in Medicare's medical insurance Part B and prescription drug Part D programs. They had additional assistance through their state's Medicare savings program based on income. And so the Affordable Care Act provision also established the Medicare pilot program for asbestos-related disease and offered additional benefits to the asbestos victims, including special home care services, special medical equipment, travel assistance to receive care, special counseling services, nutritional supplements, prescription drugs not covered by Medicare drug plans, and then assistance from a nurse case manager to coordinate health benefits and plan individualized care. And so, for the tragedy that the people of this area of the country went through, they were provided health care coverage to assist them recover from what happened to them due to the environmental contamination. They had Medicare coverage for all without harassment from insurance companies, health insurers, pre-existing and, deductible premiums, none of that. It was Medicare for all, no paperwork, no delays. And so that's what it looks like. And so people are saying, definitely, it would be nice to have that all across the nation. It is doable. It's being done. It has been done, and it's being done in the United Kingdom, in France, in Sweden. Canada has universal health care. And so it is possible that it can be done, and it has been done in the United States on certain levels. We've seen it in action. We've seen it work. People definitely want this. There is some quibbling because some people feel like, well, I deserve health insurance or health care, but they don't. We have to get past that. That's the hurdle that we have to get past. And seems like people just can't seem to let that go. Like, why should he, them, they, she, it have health care? I don't think they should have health care. We have to get over that hurdle. Once we do that, I think we can all have Medicare, some good health care coverage, the ability to really feel that we are taking care of ourselves and taking care of each other. Rand Paul has revealed his plan, and we've been this place before. A healthcare savings account. That's the big plan. I'll let you read up on what happened in Libby, what's happening with Medicare, and then you can decide what's the way that we should go. What should we shoot for? The moon, the stars, or just what we did already? Good luck.